So in this video, I'm going to talk a little bit about practice-based research, what it means to me, and then identify an example of a practice-based research that I've used in my clinical practice, and then also an example that one of my mentors have used in the past. So what practice-based research means to me is kind of evaluating your own clinical practice. So that might be just taking a step back, identifying what you're doing well, what you're not doing so well, and kind of really honing in on those flaws within your clinical practice, because those are ultimately what's going to affect your patient outcomes and the healthcare that you're delivering to your patients. So that's really important to identify that flaw and then resolving that flaw through different interventions, and then ultimately kind of looking back at what worked and what didn't work. So I think it's very important to understand that practice-based research for each individual is going to be different because we all work in very different settings. So kind of after you're reviewing some of my classmates, what it meant to them, they're very different because everyone works in a very different clinical setting. Even if they work in the collegiate setting, we all work with different patients, and we work with different coaches, so that can drastically influence our practice-based research and what it means to us. So kind of an example, just a very broad example, is in my clinical practice, I would identify an issue that I see as being an issue in my clinical practice and ultimately affecting my patients' healthcare. So identifying that issue and then kind of resolving how I'm going to fix the issue, or what am I going to do differently in my clinical practice to resolve the issue. And then ultimately, after I incorporate my intervention, kind of looking back and whether or not it was successful or not, and then making sure that I can disseminate that information and then share it with other practicing clinicians. That may be through research, it may not be through research. It could be just talking to your colleagues and kind of explaining what you found and maybe how they can incorporate it within their own clinical practice. So I think if we kind of go back to the bare bones of what practice-based research means, it's basically problem solving. So all of us have been faced with problem solving issues. So trying to find a flaw or a problem that you're dealing with, and then incorporating different ways and kind of the pros and cons in different ways that you can resolve that issue. And then ultimately looking back and whether or not it was successful or not. So if I look back in my clinical experience, one example of practice-based research that I incorporated in my clinical practice was the use of patient-related outcomes. And I never really did that until I got to ISU, obviously, because it's heavily based on patient-related outcomes. But I identified an issue, especially with the sport I worked with, football. We do a very good job at solving our patients' issues as it relates to their sport. However, we miss a very important part when we skip over their health-related quality of life. And that's a big issue that, as a clinician, I identified in my clinical practice. And I think it was also on the patient's part where they never identified their injury affecting their health-related quality of life. It was because working football or any sport for that matter at such a high level, you're always focused on, am I going to be able to play on Saturday or Sunday or whatever? So I think it was important to kind of break that barrier with my patients to incorporate patient-related outcomes in my clinical practice. So basically, looking at my clinical practice, I identified an issue or a problem. I incorporated patient-related outcomes in my clinical practice, and ultimately looking back at it, identifying whether or not it was successful or not. So kind of looking back at it, what went well? I think what went well is I was able to educate my patients, and so they have a better understanding how their injury affects their everyday living and how as clinicians, what we can do in our clinical practice and through treatment with them, how we can affect their overall quality of life and how we can improve that, just not in a sport related incident. We can affect them in their health related quality of life. So that was a big thing for me, is to educate my patients, and then also to obviously educate myself, and be able to measure what I was doing in my clinical practice and whether or not it was working. So that was a big learning curve for me in the beginning, because I never really was able to disseminate the information early on and kind of use that to my advantage later through the rehabilitation process and through my treatment of my patients. So that was something that was an early on issue with me, is kind of making sure that I regularly visited my PROMs and make sure I'm administering them usually weekly, and kind of visiting whether or not what I'm doing in my clinical practice is actually working. So that was something that, we all kind of went on this PROM fling, and one of my issues is I never really use those PROMs very consistently. I did improve upon that, and at the end of the season or through the end of the last semester, I was able to incorporate those on a regular basis and then use those to my advantage. Another issue that I came across was with my patients. I had an issue with getting buy-in for my patients. I had to ask my patients to fill out this sheet, and some of the questions on there they may have not seen very related to their specific sport, or things that they don't do on a regular basis, like open up a jar or things like that. So trying to get buy-in for my patients was an issue that I definitely had to overcome. It's not going to work for everyone. That's another thing that I found out in the end. It's not going to work for everyone, and some people or some of your patients may not take it seriously. But identifying those issues early on can definitely help you in the end to make it successful. As I look at practice-based research from one of my mentors, is last semester we had a patient of mine tear their ACL, and he had a follow-up appointment with a physician, and the physician identified issues with his extension and not being able to gain full extension post ACL tear. So my mentor identified an issue, and he started to incorporate a lot more of goniometric measurements to identify or to measure our progress throughout the weeks, and making sure that we're improving upon his extension, because he had a follow-up appointment. We had a deadline that we had to get to and a certain measurement that we had to get to. So we were consistently measuring the patient's knee extension through measurements. An issue that came about with that is my mentor identified the issue, but kind of went a little bit overboard with the issue, and that he would be taking goniometric measures multiple times a day. And that was an issue for me, because obviously the research shows that goniometric measurements multiple times a day can vary throughout the day. And so we want to stay consistent with those measurements that we're taking from the same clinician, same time of day, same point within the rehab, and make sure that we stay consistent with that. So that was an issue that I kind of identified through that, and as an observer and as a clinician, I can learn from that certain situation. So even though he didn't identify, I think he did it non-consciously, using practice-based research when it is clinical practice, but the execution of that was not the best. So I think execution is a big part of practice-based research, and that we kind of take a step back and actually identify when we're going to use practice-based research, so we can have a good plan going out from there. So overall, kind of what I've learned through this week and the past week, and most importantly, I think it really depends on the clinician. So Like I said, identified very different viewpoints what practice-based research means to all of us, and it varies from clinician to clinician, and that's something to be aware of anywhere that we go through the profession, wherever we end up, that it's going to change throughout our career, and it may not be the same everywhere. We may not have the same resources, but if we can incorporate the practice-based research within our clinical practice, we can very much so improve our patient care.